Good morning, and thank you for joining us. We are gathered on the territory of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection to this land. I am Dexter Arcand-Paul, Alberta NDP Shadow Minister for Indigenous Relations. I'm honored to be joined today by Eve Adams, the wife of the late Dexter Adams, and Dexter's niece Kathleen Crow, Samantha Bear and Diane Lafond, health ombudspersons from the Federation of Sovereign Indigenous Nations, and my colleague, Sarah Hoffman. Indigenous peoples continue to experience poor health outcomes and mistreatment within our healthcare system. We are here today to demand the UCP government stop stalling and implement all the Truth and Reconciliation Commission's calls to actions to finally ensure that Indigenous peoples receive culturally safe and appropriate healthcare. Sadly, immediate implementation of the TRC's health-related calls to action can't help Dexter Adams. But his family is sharing his story today in the hope the UCP government will act to ensure what happened to Dexter never happens to another Indigenous person. Eve went to visit her husband Dexter in an Edmonton hospital on May 6th of this year, as she regularly did during his extended stay. Upon entering his room, she was horrified to see that her husband's braids had been cut off and thrown in the garbage without his family's knowledge or consent. The family was also deeply hurt to discover that Dexter's bear grease, an Indigenous form of medicine, was also discarded, along with his eagle feather. Braids are deeply significant in Indigenous culture, and for many, it represents identity and spirituality. It is seen as a source of a person's strength. It is core to their identity, spirit, and connection to Creator. In the residential school era and day school era, braids were forbidden. In Dexter's family, hair is seldom cut other than when grieving a loss of a loved one. I'd now like to invite the family to come up and say a few words.
Thank you, Brooks. I'm speaking on behalf of my aunt, Eve Adams, today. This is just really too difficult for her to speak. So thank you, Brooks, for this. Our family has never received an explanation or an apology for what happened to my uncle, Dexter Adams. Not only was my uncle harmed by the actions of a nurse while in care at a hospital in Edmonton, but we were also deeply hurt along with members of my uncle's family and our community. The cutting of my uncle's hair caused all of us great emotional and spiritual harm. It also evoked past cultural trauma that my uncle, his family, and community experienced throughout their lives. After my uncle's braids were cut off, it was as though he lost his spirit and his will to live. He passed away 5 weeks after his hair was cut. The failure to acknowledge and respect the deep cultural significance of hair and braids in Indigenous culture crushed my uncle's spirit. This should not have happened. My uncle deserved better. Indigenous people deserve better. Thank you.
Thank you, Kathleen, for sharing Dexter's story and for advocating for all Indigenous peoples here in Alberta. I would now like to invite my colleague Sarah Hoffman, the Shadow Minister for Health, to say a few words.
Thank you, Brooks and Kathleen, for your courage and strength in sharing Dexter's story. Dexter's experience is sadly another tragic sign that public health care is failing Indigenous patients here in Alberta. People across the province are suffering from limited access to health care and reduced quality of care. These issues are only magnified for Indigenous people who face additional systemic barriers. Instead of picking fights with Ottawa at every turn or giving themselves a pay raise during an affordability crisis, Danielle Smith and her government should be focused on the issues that matter to all Albertans. Over a year ago, the UCP government received an Indigenous Primary Health Care Advisory Panel final report, which included a recommended strategy to modernize Alberta's primary care system. One of the goals guiding the panel's work was, quote, culturally safe and appropriate care for First Nations, Métis, and Inuit peoples to ensure that they have access to high-quality, culturally safe care designed and delivered in a manner that respects their unique healthcare needs, end quote. I'm incredibly disturbed and disappointed to see that the panel's work has apparently not been implemented by this government. They have the responsibility to act. If they do not, what was the point of this panel? All healthcare workers need access now and should be required to complete awareness and sensitivity training to ensure safe care for all Indigenous peoples in Alberta. That's the government's job. And they can start today by implementing their own panel's conclusions. So when you show up at the hospital as a patient, a family member, or a staff member, you should feel respected and you should feel safe. Everyone deserves the right care and the right place at the right time. And that certainly isn't what Dexter and his family felt in this experience especially. Thank you.
What happened to Dexter Adams is a heartbreaking reality why the Truth and Reconciliation Commission's calls to action, particularly numbers 18 and 23, need to be urgently implemented. The UCP government's failure to act quickly and decisively to implement the calls to action is why I introduced Bill 209, the Reconciliation Implementation Act, last month in the House. Bill 209 will ensure that the UCP government advances reconciliation in all of its decisions and moves forward on the calls to action by the TRC. The UCP government has no provincial strategy for reconciliation or for fulfilling the TRC's calls to action, despite the UCP's claims of progress. There is no clear reporting resource to track progress of any government initiatives under the calls to action. A government that cares about all Indigenous peoples and is intent on reconciliation should work to fix these issues, because Indigenous peoples in this province deserve better. Dexter deserved better. Reconciliation is about building trust and fostering respectful relationships, which requires concrete actions rather than just rhetoric or tears. Without a concrete legislative framework to implement the TRC's calls to action, Indigenous people in this province won't see the change they need and deserve. We call on the UCP to pass Bill 209 to ensure Indigenous lives are protected within our healthcare system and beyond. Dexter Adams deserved better. Thank you, and we are happy to take your questions.
It's the raise hand function to get in the question queue. If you're on the phone, it's *9. We'll start with questions in the room. Please, one question, one follow-up. State your name and outlet and who you'd like to direct your question to.
I'm not sure who this would be for. It's somebody from the family, but I just wondered what kind of correspondence and interaction did you have with the government or the health authority afterwards? And where have things been left? Oh, and Andrea Hunkar, CBC, sorry.
Do you want to just step to the mic, Kathleen?
This is my uncle after his hair was cut, and just shows the change in him as well. I don't know if I could put it up, but in terms of what happened, I really didn't feel like the response at the hospital was adequate. We were interviewed by a senior staff member who just asked questions, and that was it. There has been no follow-up. There has been nothing done concretely. My aunt never received an apology from the hospital. Basically, we felt that their actions were more just to protect themselves.
Did they tell you that they would follow up? Did they tell you what to expect or anything like that? And have you been trying to reach them since to find out what's been going on?
Really, I just found that there's a patient complaints line, but I have used it in the past, and I didn't really feel that it feels like you're just putting a call into a dead letter box. there is no follow-up, there is no investigation, nothing happens after. And if you do follow up with the patient relations complaint process, they tell you that it's privacy and they can't tell you what happened after.
Hi there. My name is Morgan. I'm with Global Edmonton. I'm just wondering if you could tell us more about Dexter, like who he was as a person, his spirituality, just kind of what he meant to your family.
My uncle was everybody's favorite uncle in our family, and definitely mine. He's been like my father my whole life. And he's just a really special man. He went into the hospital as a high fall risk, and definitely not really any health issues, but it was just so shocking to us that he lost his life like several weeks after being admitted to the hospital. Yeah, it's been difficult.
And how old was he?
He was 84 years old. Yeah.
And you touched on it earlier about his braid's connection to his spirituality. Do you mind just kind of expanding a little bit more on the significance of losing that part of himself?
Yeah, my uncle was a not residential, day school survivor. And in his era, it wasn't culturally safe to have long hair. So as, he got older, he grew his hair long, and it's something that, it was him. It was who he was. And as part of his life, to be able to grow his hair long was, something very, very special for him and to his spirit. It was basically like, it was the essence of his spirit. It was who he was. And to have that cut off, it was a huge change in him. And this is like immediately after his hair was cut off. This was him just 8 days before his hair was cut. And we have another photo.
Your auntie has it.
Okay. And this is what his hair looked like just 8 days before. And you could really see the difference in him after. There's a complete difference in him. Thank you.
Elliot Knopp with City News Edmonton. You mentioned the braids were found in the garbage. I don't mean to, pick at that too much, but can you just tell me a little bit about when you discovered it and the moments that immediately followed?
Yeah. Well, I had to call the nursing, the floor manager, and the braids were found in the garbage on top of a soiled adult diaper, and it was just, it was horrible. I can't even begin to describe how awful that was. The medicines that he had, the bear grease was for his hair, and his feather was with him, but both of those items disappeared after the cutting of his hair as well in the hospital.
And what did they provide as a reasoning for it?
There was never any reasoning provided for the eagle feather and his bear grease medicine. And there was really never any explanation provided for why the hair was cut. For us, it was really difficult to fathom because my uncle had been in the hospital for a little while. And all of the hospital healthcare professionals are quite busy, and nurses are quite busy. What was shocking to us is that this nurse, in all of the busyness of nurses not even having time to do their duties, their tasks, but this nurse found the time to cut my uncle's hair. That's what's shocking to us.
And can you share where this happened at all?
It happened at the Royal Alex Hospital. Yeah.
Catherine Gurkowski, Alberta today. You had mentioned that this impacts not only your family but your community as well. How do you think this has a ripple effect when it comes to accessing healthcare, to going to a hospital when you need it?
I think cultural safety has always been difficult in hospitals for Indigenous people. And I think we even just need to look at, Joyce Echequan and how much things have changed since that time. It really hasn't. And not just Alberta, but all provinces need to do better in the care of Indigenous people accessing healthcare.
And a question for Brooks. I'm wondering, on your private member's bill, has the Minister of Indigenous Relations reached out? Have you had any discussions with government members on your bill?
So we've reached out to the minister's office to discuss the bill and the potential support for it, and our calls have been left unheeded. Unfortunately, we know that this government likes to talk about reconciliation, but when it comes to finalizing and committing to work on the calls to action, we're left with wanting.
Hi, I'm Jack. I write for the Canadian Press. I have a couple housekeeping questions. So I'm sorry these ones are kind of short and quick. How long ago did this happen?
So, do you want me to answer that, or do you want to? Go ahead.
It happened on May 6th, 2024.
Awesome. And then I don't actually know where your family is from. Was Dexter living in Edmonton before you went to the Alex, or?
My uncle is he's a registered member of Pasqua First Nation in Saskatchewan Treaty 4.
Awesome. Thank you.
Hi, Andrea again, CBC. I just wondered, how does Alberta compare to other provinces like Saskatchewan when it comes to issues like this in investigating? And how can Alberta go any further in the way it addresses these inequities and instances?
I'll let Diane speak.
Danse, thank you for the question. I want to acknowledge and be respectful that we are visitors today in the province of Alberta, as well as to the treaty territory here. My name is Diane LaFond. I'm the First Nations Health Ombudsperson for Saskatchewan under the Federation of Sovereign Indigenous Nations. And when Kathleen mentioned that the late Dexter was from Pasqua First Nation, that's how we became involved in the investigation. We are a new organization that's been open since July 1st of last year. And Dexter, the family, came to us for support and investigation, and we've been supporting them along the way. And we wanted to be here today to stand behind them and stand with them to elevate their file. But it's comparable. Like I would say Saskatchewan, we have, with our office being in operation for, over a year, we do have over 300 files. For an office that's so new that, it's not really out there that we exist, it's quite a large number. So we're seeing the cultural, awareness happening here, with what happened to late Dexter, and really acknowledging that, the pain and what the family's endured and gone through is comparable to what's going on in Saskatchewan, right? So it's, we need to do better in the healthcare system, and I understand there's pressures in all healthcare systems straight across Canada. I've seen that and I've read that in the news. And, building these relationships and understanding that First Nations people, are a big part of, Canada and the healthcare system and the disparities in health. A lot of people sometimes think it's like this, but the healthcare disparities are like this. There's a lot of gaps, and our lifespan is shorter. So, there's a lot of things that we can do better. And honestly, today it's about Eve and supporting her and losing a part of her partner. It's the pain that she's experienced it didn't have to happen, right? It didn't have to happen. So with that, I just wanted to let you know that, yes, our organization is from Saskatchewan. We're here supporting the family today. And I thank you.
If I could just
Have a follow-up?
one thing on that.
Sure.
Yeah, sorry, if you don't mind. Thank you. I just want to commend all of these incredibly strong women for being here today. This isn't about one healthcare worker in one hospital. This is about making sure that education is in place across Alberta to stop racist acts or things that that are harmful to patients from happening anywhere in the province of Alberta. And hopefully it'll reach even further. But they really wanted to share their story so that people can learn from this and act to make sure that all healthcare workers have the education to make sure that everyone is safe at the hospital and gets the right care.
Sorry, I don't know. We don't have an ombudsman here, do we? Like a health op? No. And how much do you think that could have been helpful in your journey to today?
I believe that having a health ombudsman, especially a First Nations health ombudsman, would be a really essential, step in addressing the racism and discrimination in accessing health in Alberta. I understand that the Treaty 6 Health Office, the chiefs are creating a First Nations health ombudsman position. The difficulty with that, though, is that they will only represent their own membership, the Treaty 6 membership. So we would have been excluded from that process. So I believe that there needs to be something, and I'm hoping that Bill 209 would be implemented and that we could have we could access healthcare safely without discrimination or racism.
Thank you. We're just going to go to the lines now. We have Jackie Carmichael from the Edmonton Journal. Your line should be open.
Sorry this happened to Mr. Adams. Was he waiting? Were they waiting for long-term care placement for him? It sounds like he was in a very fragile condition. And how long have he been in the hospital?
He had been in the hospital since about March 23rd, I believe. He was awaiting long-term care. He was in the hospital. He was classified as a high fall risk. But other than that, he had a bit of dementia, but he was in quite good health. And even his passing away, there was no medical reason for his death at the time.
Did they say why he had not been placed in long-term care, or had long-term care been offered at all?
We were waiting for long-term care, but I understand that's another difficulty in this province is the wait for long-term care can take quite some time, I understand. After the cutting of my uncle's hair, though, they did expedite his placement into long-term care. But
I'm sorry, he was placed in long-term care before he departed?
Yes, he was only in long-term care for maybe 2 weeks, 3 weeks.
1 month.
3 weeks, yeah. And he passed away after.
Okay, we'll do one more quick pass for questions. Any more questions in the room?
I'm just wondering how, if any, has this changed how you feel about Alberta's healthcare system?
For me?
Yeah.
I believe it just makes accessing healthcare that much more challenging, because are we going to be treated the same as, is our culture, our spirituality going to be respected while we're there? Are we going to be judged, not even in this incident, but, we're often assessed with having, we're often just looked on in a demeaning manner in accessing healthcare. Yeah.
Kind of a similar question. We've heard today that Bill 209 would be a help. Having a health ombudsman and specifically an Indigenous health ombudsman would be a help. I guess on a more personal level, you'd mentioned that you haven't received an explanation as to why this happened. You haven't received an apology. So for that personal sense of justice, is that something the family wants? Do you want an apology? Do you want an explanation? Do you want all of those details to kind of get that settled feeling?
That would be wonderful to receive that, but it would help in bringing more closure to have the hospital investigate their own systems in terms of cultural safety with Indigenous people. But I think the most important thing that we discovered afterwards is that the hospital Indigenous workers voiced that they don't feel heard in the hospital. They also expressed to us that they didn't feel that the training that healthcare professionals are receiving in the hospital is adequate. And after my uncle's hair was cut, we also believe that as well.
We have one more question from Jackie Carmichael.
I'm sorry, I didn't lower my hand. I apologize.
Fine, Jackie. Anyway, we'll do one. I think that, is everyone good? Thank you. Thank you, everyone. That concludes our press conference for today. Thank you all for being here.